everyone. Thank you all for joining. Today we have the great honor and privilege of having Ms. Sarina Logan with us. Sarina was diagnosed with non-small cell lung cancer in 2018 at the age of 41. And biomarker testing revealed that she was EGFR positive, which led her to the medication that she's on today and into remission. And she's joining us today with the American Lung Cancer Screening Initiative to share her story. So Sarina, thank you so much for your time and willingness to be here with us.
Thank you for having me. It's a pleasure.
Awesome. So before we continue, we just want to launch a quick poll to get a feel of the audience we have today. I'll just launch 2 questions that ask how much you know about lung cancer and lung cancer screening. So if everyone could take a couple of minutes to just fill this out, that would be awesome. Okay, it looks like we have a lot of responses in, so I'm going to end the poll and share the results. So it's great to see that we kind of have people in all different levels. Some people know a lot about lung cancer screening, and some people don't know a lot about it. So it's great to see that there's a mix of audience members here today, and we just hope that through this podcast and this session that you guys might be able to learn more about both of these topics today. Great. So to introduce myself and my team, my name is Priyanka Santo, and I am the Program Director of the American Lung Cancer Screening Initiative. And with me, I have Anish Gogilam. And as I mentioned before, we are part of ALCSI, which is short for the American Lung Cancer Screening Initiative. And I have just a couple of slides to share a little bit about our organization. So hopefully everyone is able to see my screen. ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. And we're a team of over 200 students and doctors located across the United States. And we do the work that we do because lung cancer is the deadliest cancer in the world, causing more deaths than breast, prostate, and colon cancers combined. And lung cancer causes about 380 deaths per day in the US alone. Lung cancer is very fatal because currently many patients are being diagnosed at a late stage when the cancer has grown and spread to other parts of the body. Lung cancer screening is an effective imaging technique that can be used to screen for lung cancer and has been shown to catch lung cancers early. However, less than 6% of people at high risk for lung cancer are currently getting screened. And the screening rate for lung cancer is much lower than the screening rates for breast, cervical, and colon cancers, which are about 70%. We believe that educating people about lung cancer and lung cancer screening is one of the most important and effective ways to increase the lung cancer screening rate for populations that would benefit from lung cancer screening. So far, we've given over 120 presentations on lung cancer and lung cancer screening to universities, hospitals, medical schools, and organizations around the US, as well as India, Canada, Brazil, and Mexico, reaching over 10,000 people. And over the last year, we worked with 105 mayors from every single US state to issue proclamations recognizing November as National Lung Cancer Awareness Month. We've also had the opportunity to work with several leaders at the state level, including Arizona State Senator Leila Alston, who's a lung cancer survivor, Pennsylvania Governor Tom Wolf, and the Lieutenant Governor of Colorado, Diane Primavera, to increase awareness about lung cancer screening. And in addition to our education, outreach, and advocacy efforts, we recently started a podcast series to share the personal side of lung cancer and provide a platform for lung cancer survivors and advocates to share their stories. And last fall, ALCSI worked with US Congress members and senators to draft and advocate for the first ever House and Senate resolutions recognizing the importance of early detection of lung cancer through screening. And in December 2020, the Senate resolution was passed with unanimous consent, marking the first time the US Senate has ever recognized the importance of screening. ALCSI has also been actively working with Representative Brendan Boyle and Senator Tina Smith to draft and advocate for Catherine's Law for Lung Cancer Early Detection and Survival Act of 2021. Lastly, we want to end by talking a little bit about lung cancer screening. Lung cancer screening is done using a low-dose computed tomography scan. And this scan uses low radiation doses, is pain-free, and takes less than 5 minutes to complete. The United States Preventive Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. And right now, they recommend people between the ages of 50 and 80 who have a 20-pack-year smoking history or more, and who are current or former smokers who quit within the past 15 years, get annual low-dose CT scans. 1 pack year is defined as smoking on average 1 pack a day for 1 year. So 20 pack years can be met in a variety of ways, including smoking 1 pack a day for 20 years or smoking 2 packs a day for 10 years. And if you know anyone who might be eligible for lung cancer screening based on the criteria listed in the previous slide, please share this link given by the QR code so that they can get in contact with one of our doctors about lung cancer screening. And finally, we want to highlight that there are other risk factors for lung cancer in addition to smoking, such as exposure to asbestos, a family history of lung cancer, COPD, and previous radiation therapy to the lungs. And we believe it's important that we recognize these additional risk factors because a large number of people in the United States who have never smoked still get lung cancer. Right, so without further ado, we'll jump right into the podcast. We have a few questions prepared for Sarina, but we also have a Q&A session at the end where you all can submit any questions you have for Sarina. And this podcast is being recorded and will be shared on our Spotify, Anchor, Google, and Apple podcasts, as well as our YouTube channel. So first off, Sarina, could you please introduce yourself and share your background?
Sorry, I had myself on mute. My internet's a little spotty, so if I go in and out, bear with me. I am Sarina Logan. I was diagnosed in 2018 with stage 3 lung cancer, and I was testing and came back with being EGFR positive. So I have the exon 19 deletion, but came out of the blue. So all this stuff was really new to me. And luckily I had an ally in the GoTo Foundation because Bonnie Adario, who runs the foundation, is a family friend and has known me since I was 3. So she was my second phone call after my parents, the minute they told me I had lung cancer. And I was then to do and what I should learn about. And it was super helpful, but there's not enough information out there. And for someone like me, it's very unknown and it's unexpected. So it's something that wasn't even on a radar to begin with. But yeah, now I'm here to share the story because I feel like the more we talk about it, I'm very transparent about it. The more we talk about it, the more we can get word out and people don't have to become I'm actually stage 4 now because I had a recurrence, don't have to get to that stage point. It can be caught with screening at stage 1 and then it's curable.
What was the experience like when you first received your lung cancer diagnosis?
Definitely shock. I didn't have symptoms of any kind. I think it was more just a pain in my side, and it just wasn't even on the doctor's radars. They didn't even touch base on it possibly being cancer, which was just not something they thought of. First of all, my age, I was only 38, had no history of smoking, and there was nothing to give them any clue as to why it would have hit me. So dealing with the initial diagnosis was mostly shock and kind of fear in the beginning. And then as you go through, I had to just start doing things. So as a patient, you just do what you're told, which is actually kind of not nice, but at least you're not having to try and figure out things on your own. And it's not as scary when you know that you have doctors who are here to just tell you what to do and hope for the best, hope that they get the right treatment.
And could you share more about the timeline between maybe the onset of symptoms and your final diagnosis?
Yeah, I had symptoms for a few weeks prior. It just a pain. Like I said, there was nothing, no coughing or anything. I felt this pain and I kind of ignored it, and then went and got a blood test, and they did an X-ray, and they said there's something in your lung. And that was in October. So I maybe 3 weeks of what turned out to be the tumor pressing on my lining that was causing this pain. But again, it wasn't necessarily symptoms. As soon as they diagnosed me, we started treatment.
Did you have?
Initially, because it was in my lung and some of my lymph nodes, they decided that a lobectomy would be the best procedure to take out the tumor itself. So I had my third lobe on my right lung removed where the tumor was, through a lateral surgery, and then they did IV chemo. So I had 4 rounds of IV chemo. I avoided radiation after talking to a second option. You should always get a second opinion, second, third, fourth, whatever you need. So I did that, and they said I could probably forego the radiation if I went with the higher dosage of chemo, which I did. And then I went about, I'd say 6 to 9 months with clean scans, and then it recurred. And when it recurred, it went to the other lung and to my brain. And that was the point where we were thinking we'd just go back to chemo and this time for sure radiation. And I had to have the brain radio surgery to take care of the tumor, which it shrank. And I became kind of forefront for this new medication that I'm on, called Tagrisso, and I was a prime candidate for this medication, and the tumor board unanimously decided that I would be perfect for it. So they decided that because of that, then you don't do IV chemo. This is kind of a form of a targeted therapy. And as soon as they put me on that in May of 2020, in 3 months, I went into remission and have been on this medication since then. So 2.5 years, or just over 2 years.
Well, it's great to hear that, your cancer's gone into remission. And you mentioned that you tested positive for the EGFR mutation. And just wanted to ask, could you talk more about the biomarker testing for maybe individuals who don't know about that?
Yeah, absolutely. As least scientific as I probably am, the biomarker testing was a liquid biopsy that they did on my blood, and it was at the suggestion of the GO2 Foundation's founder, Bonnie. She said, we're seeing this lung cancer present in women under 40 more commonly, and she knows, she's the director of this foundation, and she's seeing it. And she said, you should do this biomarker because they have targeted therapies out there now. So at her advice, we did this liquid biopsy. So liquid biopsy basically came back showing that in your DNA strand, there's numbers in your DNA strand, and I have this exon 19 deletion. So it's just missing from my DNA, and something triggered it. And this is all we know. We don't know what triggered it. We don't know if it was environmental, if it was my age. It's supposedly genetic, but there's not enough research because it's so new almost. I mean, it's been around for a while, but it's presenting so rapidly that we don't have the information caught up to it yet. So the liquid biopsy allowed me to kind of pinpoint exactly what this cancer was.
In what ways would you say that your life changed after your diagnosis?
Cancer changes you, period. It's hard for anyone who doesn't have cancer to really understand it, nor would I want them to. But your life just changes. I think you change as a person. You're faced with this mortality that you didn't expect, especially if you're younger. So I think overall, cancer has actually given me more than it's taken from me. Because of this diagnosis, a lot of things that maybe didn't matter do, and the things that simply just don't anymore. And I feel like it has given me the opportunity to stay more present. So I think that helps me process, because we know that this is an aggressive cancer. But I think that overall, the way it's affected me has actually made me appreciate what I have, and kind of made me want to know more about it. And it's piqued my interest as an advocate. So I feel like it's just presented more opportunities for me, but certainly has changed my everyday life and thought processes as well.
With other patients that we've talked with, I think a lot of them have a similar experience where their lung cancer did change the way they perceive the world and what they view are their priorities. But a lot of patients still struggle with, the uncertainty about the future at the time of diagnosis, and the reflection that comes after maybe is more clear. But right after diagnosis, how did you deal with that uncertainty of knowing, what the future holds?
It's hard to say when you're in that position how you can feel, really. Knowing the aggressiveness of this cancer is scary. Knowing that we don't have all the answers is scary. I think it's just a fear, but really the fear is just the unknown at this point. I think that it's an ongoing processing. That's just the nature of it. You continually have to deal with it. And it certainly affects all of your future plans. It's always in the background. But for the most part, because I'm able to function pretty well, I can forget about it. But yeah, it's something that affects just the way you think about the future. I think hopefully for the positive, just thinking that you just stay in the present moment, because you don't know what time you have left.
It's interesting. So did you have any misconceptions maybe that you had heard from other people or seen online about lung cancer before?
I don't know if I necessarily had misconceptions. It wasn't really anything that I thought of, to be honest. It's if it's not present in your life, you don't, I guess ignorance is bliss. It's just not something you think about too often. I certainly, like everybody else, probably for the most part, we know that there's a preconceived notion about it being a smoker's disease. So for me, that's probably what I associated it with too, not knowing that, again, just not knowing that it's something else as well. I think that's just a miseducation or an uneducation maybe on the part of just society in general. They just don't know, and not to anyone's fault. It's just not spoken about as, I guess, as much as it should be. And that's the whole point of doing what I do.
And had you heard about lung cancer screening before? And did you have any concerns about it?
I didn't hear about lung cancer screenings until I got involved in advocacy. To be honest, it's just not something that was really spoken about. But anyone that I talk to is on board, because I mentioned in my opening, if we could just diagnose this with a simple screen at stage 1 and it's cured, then I'm all for it. It's just that it's not talked about. I actually started talking about it, and my childhood babysitter said, "Hey, can I get the screen from my doctor?" I was like, these are the questions that people should be asking just on a normal basis. She just asked in conversation. And for me, that means that I'm doing something to educate, because we just don't know enough about it. It's not spoken about. And if we can get it so that it's a regular thing, I think we can save a lot of lives by doing it. Not we, like I'm doing it, but.
So what are your recommendations about, educating society about lung cancer screening?
I think advocacy work, stuff like this, podcasts. This is such a great opportunity for me, because I feel like we don't have enough of them. So just speaking about it, I think if you just get it in conversation. I just moved into a house and we had some handiwork done, and I just mentioned it to him, and I said, "Hey, tell your wife, just be aware if she has some weird pain or some symptoms, just be aware of it. And he said, oh, well, she had a pain the other day. And I said, you know, it doesn't hurt to be overly cautious. And I think if we just continue to use these platforms, social media, stuff like that, just to get the word out, at least it's been spoken about, and someone may go, oh, hey, maybe I should talk to my doctor about a screening. Or, you know, the more we ask questions, I think we can use stuff like podcasts to help.
Did you share your lung cancer diagnosis with others, and how did you start that conversation?
I did, mostly because everyone was kind of around me. I have a pretty big unit of people who were there to support me. Mostly, I think, because they want to know what's going on too. Anyone who's really in your life really wants to know. I mean, I was hospitalized for 3 days in the beginning, and then obviously through all the surgery and the chemo and stuff, you don't really get away with doing those things without people noticing. So for me, it was, I've always been really transparent about it and upfront. So I think the conversations start out pretty naturally. It's because I've learned to advocate. That I'm looking to bring it up in every conversation, but it doesn't hurt if it's mentioned or, you know, just discussed. For me, it's not something taboo to speak about. I think it's important that we do talk about it.
Can you please elaborate on the process of getting a CT scan? Like, what were some things going through your mind beforehand, and like, what did you think of it after?
Yeah, the initial one, they initially just said, just go get an x-ray. We think you've pulled a muscle. We didn't, this is prior to even being hospitalized and doing a biopsy. So they did the x-ray, and he said, I'm gonna have to give you the CT scan because there's something on your lung. And it was the first time I had ever really been in a situation like this. So for me, it was brand new. I'm a pro at CT scans now, but in the beginning, they're a little scary. And it's not really, that's not like a goal I wanted to have, but I think it's, again, it's that I go back to that fear and that scary. It's just because it's unknown. So it's something that you're not expecting, despite the fact that they're minimally invasive, you know, and then they take roughly 15 minutes, it's still, what's it gonna show? And I have that fear every time I have a CT scan. It has never gone away. I hope, you know, but maybe it's keeping it at the forefront by doing that. So the process of getting a CT scan kind of keeps it in your head. It's always kind of in the background, but those are the reasons that I'm staying live. So it's, you know, being able to have a 15-minute scan every 3 months, I feel like is completely worth it.
And what motivates you to share your lung cancer story publicly?
I think for me, it's because it was so unexpected, and it's such a shock. And I think it would be a shock to most people, no matter what. Cancer is not something that anyone wants to hear. And I think what keeps me motivated is that I'm hoping that if I continue to advocate, that at some point maybe we can come up with a cure. That's, I think, everyone's goal when they're really speaking on behalf of lung cancer patients. But the motivation is just the fact that I'm hoping I can help other people. There's got to be a purpose for this, and that's always been my feeling on this, on the diagnosis itself. Is in order for me to process, I have to know that I'm doing something with it. That's just kind of the way I'm wired. Like, there's a bigger purpose for this. So that's a motivator completely in itself.
Well, it's truly inspiring to hear you speak with it with such fortitude and belief in the advocacy and everything you've been doing. So do you mind just talking briefly about like what it is that you've been doing for the lung cancer community through your advocacy efforts?
Yeah, so a lot of it, again, came from that Go-To Foundation, which was just a wealth of information. And again, I'm super lucky that I had it at hand, but people don't know about it unless you're somehow involved in it. And if people are interested, I say, please do. Please come in, do whatever you can, just read about it. talk to your friends about it. It's something simple, but there's so much online now. And luckily it's avoided any real misconceptions or misinformation. So my advice would be to look it up. Just do research on your own. There's plenty of stuff on social media. There's tons of platforms that are getting more and more doing stuff like this, podcasts, where you might not be something you would pop on to listen to, but maybe if you have a few minutes and you're curious, these kind of venues allow us to continue speaking and getting more people involved as well. You don't have to be a lung cancer patient to be affected by it. And it goes back to the saying, if you have lungs, you can get lung cancer.
Right, and I think it's so important that we raise awareness about exactly that, that it's not only a smoker's disease, but in other individuals, even those that don't meet the current lung cancer screening criteria, the individuals 50 to 80 and with a heavy smoking history can also get lung cancer. And a lot of the risk factors going to go back to what we shared in the beginning of the podcast with the additional exposure to secondhand smoke or radon or asbestos. So all of these also increase an individual's risk for lung cancer. So I think it's just so important that we start to move away from that stigma that exists around lung cancer between smoking and the disease.
100%.
And we wanted to ask you, what do you believe are the current challenges that the lung cancer community faces? I know you touched upon the lack of education. Do you else being a major challenge for the lung cancer community?
I think funding, a lot of the funding is not done simply because it's just less known. It's not as prevalent as breast cancer, but its mortality rate is higher than 3 cancers combined. And there's just not enough funding to get research, because that's really all we need is the research. I think it's certainly lacking. I think Congress needs to be involved more, and I've seen platforms for that. I think overall we can spend money getting some answers to some of these questions. Why is it affecting women under 40 all of a sudden? And what can we do to get these targeted therapies to continue to be developed? So that's definitely maybe not even secondary. I think it's right up there with everything else.
So obviously for anyone who is diagnosed with lung cancer, like you said you were in 2018, there's a lot of things running through your mind. Like it's one of those things where your whole life like flips over in a split second. I can't even imagine what it was like. But what advice do you have for someone who might be newly diagnosed with lung cancer? What are some things they should ask for? Maybe their PCP. Like, just talk to that, please.
Mostly, I think it's just asking the questions. Just, you have to be curious, because there's so many things that you don't know, but try not to get overwhelmed. I mean, as a newly diagnosed patient, most of the time it's going to be a shock. I mean, I can't imagine, even if you were a smoker, that it wouldn't still be a shock to get a cancer diagnosis. So I think overall, to start out with, is just do research on your own, ask questions. Your oncologist is there to help you. And if you don't have an oncologist to help you, get a new one, or one that doesn't want to. If you think that you need more answers, definitely get, like I said, second opinions, but go ahead and get third and fourth, because they're out there to help you. And they'll guide you through it. There's a lot of resources out there. So as daunting as it may seem in the beginning, as a newly diagnosed patient, there are answers. And I think that the more we talk about it and they have the opportunity to find these platforms to reach out to other people, you're not as alone. It feels very alone in the beginning, but you're not. There's a bunch of us out here.
You mentioned asking questions. What are some of the important questions to ask your oncologist or your primary care doctor?
Really, I think those are pretty individual things. I think it's more as they come to you. For me, it's like, what kind of treatments are out there? What are options? I don't even know that. I think they might even have lists online of some questions. I always said, take someone else with you to your appointments, because you're not going to hear everything. That's probably one of the main ones I would say, because it's so much information to try and take in. And as a patient, there are things you're going to miss that someone else in the room might hear. And that I can say that from experience. I think that's a huge one. And as you come up with questions, write them down. There's no stupid questions, obviously. I mean, it's just so unknown. So I think stuff like that, you know, you can ask. I don't know. I think they're so personal, but again, whatever questions come to your mind as a new patient, it's overwhelming at first.
What would you say for someone who may have a loved one? Let's say there's someone who's just diagnosed with lung cancer. What should their family and friends do? What are some things that, how can they help as best as they can?
You know, it's hard because I'm coming from a patient point of view, but from a friend or family's point of view, at least I can say as a patient, what really helps me is I'm very introverted and I'm kind of an independent person. So I'm not good at asking for help. But as a cancer patient, I think they maybe just listen to this patient that you're helping with, or even if you know them or a friend or family. Because more than often than not, the patient's going to ask you. And I think if you're just there and they know that, that's often more than enough. I'm lucky I have a huge support system, and they check in every now and then. And it's connected me with a lot of people that I had maybe lost touch with, which is kind of really one of the cooler parts about it. I've redeveloped relationships. My college roommate and I reconnected, and she reached out because she heard I had cancer. And if you can just be there for the patient, I think that's the first thing. Just listen to what they have to say. It's scary for everybody.
Earlier, you recommended that a patient gets, multiple opinions. And so after getting multiple opinions, how do you determine what the right course of treatment would be? Because you might have differing recommendations from doctors.
Absolutely. That's actually a great question. I think I was lucky because both of my oncologists, so I had my initial oncologist and then I went to another one, and the initial one said, absolutely, please do go get another opinion. And I think it came down to his humility and saying that he doesn't have all the answers and he's open to hearing other ideas, which is really the foundation of what medical practice should be, because at no point is one doctor going to know everything, especially about a newer cancer. So I'm lucky in that sense, and they worked together. And so they had differing ideas, but my main oncologist said, if you as the patient really make the final decision, but if you're comfortable with what he's saying, I'm totally on board too. I'm listening to you as the patient. So I think that's the biggest thing. You'll find that it's easier to come up with those solutions, and you don't have to do them as the patient. They will say, hey, this is what we think. And typically they'll take it to a tumor board. I'm lucky I have a tumor board to review things. And even though my oncologist, the main one, wasn't sure about Tagrisso as my treatment plan, he took it to the tumor board and they recommended unanimously that I do it. And he said, okay. And really, I feel like every patient should have the opportunity to have that knowledge and help, because they're really going to know the best option for you.
I think that's fantastic advice. Thank you so much, Sarina, for taking time out of your day to share your story with us. It was really great listening to your perspective on things and just getting to know you. So now I'd like to open up the floor to the audience to ask any questions that they may have about your story, and of course, if you feel comfortable answering those. So if you guys would like to ask Sarina a question, please put it in the chat or just unmute.
I have a question from the audience. The person asks, do you have any advice for people looking to get involved in the lung cancer community?
Yeah, for sure. Just honestly, it's going to sound silly, but just look it up on the internet. And I know that seems like a simple answer, but that is your best weapon right now, because it's the easiest way to really find all of the solutions. The go-to foundation, again, you can look their information up and they're always posting things. Social media is a really good way, really just using the search engine and typing in lung cancer advocacy, lung cancer in general, really. There's a lot of opportunities out there.
Thank you. Another question from Alicia. She asks, what is the biggest thing you've learned and the hardest challenge you've had to overcome?
I think the biggest thing I've learned is that I have no control over any of it. Really, it's daunting to try and figure out next steps all the time. And it's bigger than me. I just had to release, and I guess I was kind of a controlling person before it, but it kind of forces you to acknowledge that part of it. And for me, that was the challenge in itself. So I think that was probably the biggest challenge, is knowing that I just don't have the control over this anymore, but I got to figure out how to process it properly. It just changes you so drastically. That in itself is a significant challenge.
So I received a question from the audience. How did you manage your mental and emotional health throughout the process?
That's a good question. It's I think, again, it goes back to maybe me doing something about it. I immediately got involved, and I actually, because I had known Bonnie for so long, I had done some of the fundraisers with the Go-To Foundation prior to even being diagnosed. It was just a weird coincidence that I got the same cancer. So I think that helped me process it, because I knew that I had this foundation and a reason to kind of have this journey. I don't know that there's any right or wrong way to process it. There are bad days. There are days where it is harder, and you have these mini existential crises about why you're doing all of it. But I think overall, if you, for me at least, knowing that I'm putting something forward, it has helped me get through all of the mental aspects of it.
Awesome, thank you. Another question from the audience. They ask, how did COVID-19 play a role in your cancer journey?
That's a great question. It affected it because I had to become completely isolated. I'm immunocompromised due to the cancer. So COVID hitting, especially being a respiratory infection, putting you into pulmonary distress. I mean, it's almost like it was pinpoint for a lung cancer patient, just in that aspect. So for me, I really had to go into complete isolation. I didn't go to the grocery store. I didn't interact with people for those 2 years, because especially prior to having any vaccinations available, the idea that I could get COVID meant a respirator. There just was no question about it. It was kind of more factual. So I think for any lung cancer patient, not any cancer patient in general, obviously with immunocompromised systems, COVID's not great, but you think about a pulmonary disease and then this pulmonary virus, it presented its own challenges. Certainly I'm much more isolated and protected than prior to it, as most people are, but I think people also are worried for me too. So if they know I have cancer, I think there's an elevated level of urgency on protecting the cancer patient.
So you mentioned earlier that one of your biggest pieces of advice would be to get a second opinion because you'd rather know more than less. So how do you find the courage to say it may be a good idea to get a second or third opinion?
That's a really good question. And I'm fairly quiet and timid when it comes to asking questions. So that's, for someone like me, that's actually, that was a learning curve. So I think it just came down to, I didn't want to hurt my oncologist's feelings by asking, hey, I don't, you don't want to sound like you're mistrusting what they're telling you, but it's not that. Any good doctor should offer it, really. They should say, I think you should get a second opinion. I'm quite certain that my oncologist did that. If he didn't, he would definitely lean me towards it. And I had the Go-To Foundation pushing to say, hey, just tell them you want to get another opinion. We have a doctor lined up for you, no big deal. And any good oncologist will say yes. And like I said, any really good oncologist is going to offer it to you because, again, not one person. Sometimes in order to solve a problem, you just need another perspective.
So looking back at your journey, is there anything that you would do differently or you wish you knew before your diagnosis?
That's a tough question, actually. I don't think that there's anything that I wish I knew because, you just go through it, I guess. I don't know that it would have presented any other outcome. Obviously, I wish I knew about it. And I did have this Go-To Foundation, so it wasn't completely foreign to me. I think it's just a matter of accepting things, and now I get to advocate and hopefully make some significant changes. I think overall, when you're faced with mortality, like a cancer diagnosis, especially stage 4, you want your life to have some significance. I think that's really what any human wants in general, their life to have some sort of impact. And this kind of fulfills it, and I get to be part of it while I'm still alive. So I think that's actually pretty cool.
So overall, what would be one word that you would use to summarize your entire journey from diagnosis to now?
Oh my gosh, that's a hard question. Hope. I have hope. I have hope that there will eventually be a cure for this.
So on that note, again, we'd like to thank you. Thank you so much for your willingness to share your story and your advocacy efforts and all of those things. And thank you for sharing your story and perspective on so many of the pressing issues of the lung cancer community. And thank you everyone for joining our podcast. Please keep an eye out for our upcoming podcasts and events, which will be listed on our website, which I had posted earlier, www.alci.org. And we also encourage you to join our monthly newsletter where we share our updates on our upcoming projects within our organization. There's also a Google form, so please fill that out if you'd like to be added to that mailing list. Before we end this, we would also like to offer a brochure highlighting some of the key information about lung cancer and lung cancer screening. If you find it helpful or know anyone that you think may find it helpful, please relay the information around, and it's all in the brochure, so feel free to share it. Thank you, everyone, and have a great day. Thank you again, Sarina.
So much.
Thanks so much, everyone.